ये रिप्रोडक्टिव हेल्थ का एनसीईआरटी है, जिसमें हम देखेंगे सबसे पहले रिप्रोडक्टिव हेल्थ प्रॉब्लम फंड ऑफ स्ट्रैटेजी, फिर पॉपुलेशन एक्सप्लोजन एंड द बर्थ कंट्रोल, मेडिकल टर्मिनेशन ऑफ द प्रेगनेंसी, एमटीपी, सेक्सुअली ट्रांसमिटेड डिजीज और इनफर्टिलिटी के टॉपिक को। तो एनसीईआरटी कहता है कि you have learned about the human reproductive system and its function in the chapter 2. Now let us discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to the healthy reproductive organs with the normal function. However, it has a broader perspective and includes the emotional and the social aspect of the reproduction also. According to the World Health Organization (WHO), reproductive health means a total well-being in all aspects of the reproduction. That means the physical, emotional, behavioral, and the social. Therefore, a society with people having physically and the functionally normal reproductive organs and normal emotional and the behavioral interaction among them in all the six related aspects might be called the reproductive healthy. Why is it significant to maintain the reproductive health, and what are the methods taken up to achieve it? Let us examine them. So, reproductive health programs and the strategy. India was amongst the first country in the world to initiate the action plan and programs at a national level to attain the total reproductive health as a social goal. These programs, called the family planning, were initiated in the 1951 and were periodically assessed over the past decades. Improved programs covering wider uh, reproduction related areas are currently in operation under the popular name Reproductive and the Child Healthcare RCH program, creating awareness among the people about various reproduction related aspects and providing facility and the support for building up a reproductively healthy society are the major tasks under these programs. With the help of the audiovisual and the print media, governmental and the non-governmental agencies have taken various steps to create the awareness among the people about the reproduction-related aspects. Parents, other than the close relative, teachers, and the friends, also have a major role in the dissemination of the above information. Introduction of the sex education in the school should also be encouraged to provide the right information to the young so to discourage the children from believing in the myth and having misconception about the sex-related aspects. Proper information about the reproductive organ, adolescence, and the related changes, safe and unhygienic sexual practices, sexually transmitted disease, STD, AIDS, etc., would help people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in the marital age group, about the available birth control option, care of the pregnant mother, postnatal care of the mother and the child, importance of the breastfeeding, equal opportunity for the male and the female child, etc., would address the importance of bringing up socially conscious, healthy families of the desired size. Awareness of the problems due to the uncontrolled population growth, social evils like the sex abuse and the sex-related crime, etc., need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible and the healthy society. फिर कहता है कि सक्सेसफुल इम्प्लीमेंटेशन ऑफ द वेरियस एक्शन प्लान टू अटेन द रिप्रोडक्टिव हेल्थ requires a strong infrastructural facilities, professional expertise, and the material support. These are essential to provide medical assistance and care to the people in the reproduction-related problems like the pregnancy, delivery, STD, abortion, contraception, menstrual problems, infertility, etc. Implementation of the better technique and the new strategy from the time to time are also required to provide more efficient care and assistance to the people. A statutory ban on the amniocentesis for sex determination to legally check increasing millions of the female feticide, massive child immunization, etc. are some programs that merit mention in this connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cell and dissolve the substances. This procedure is used to test for the presence of certain genetic disorder such as Down syndrome, hemophilia, sickle cell anemia, etc. determine the survivability of the fetus. Research on the various reproduction-related areas are encouraged and supported by the governmental and the non-governmental agency to find out new methods and to improve upon the existing ones. Do you know that the Saheli, a new oral contraceptive for the females, by developed uh, by the scientists at the Central Drug Research Institute (CDRI) in the Lucknow, India, Better awareness about the sex-related matters, increased number of the medically assisted delivery, and the better postnatal care, leading to the decreased maternal and the infant mortality rates, increased number of the couples with a small family, better detection and the cure of the STD, and overall increased medical facility for all the sex-related programs, etc. all indicate improved reproductive health of the society. फिर आता है पॉपुलेशन स्टेबलाइजेशन एंड द बर्थ कंट्रोल का टॉपिक तो कहता है कि इन द लास्ट सेंचुरी एंड ऑल राउंड डेवलपमेंट इन द वेरियस फील्ड significantly improved the quality of the life of the people. However, increased health facilities along with the better living condition had an explosive impact on the growth of the population. The world population, which was around 2,000 million in the 1900, rocketed to about 6 billion by 2000 and 1.2 billion in the 2011. A similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in the death rate, maternal mortality rate (MMR) and the infant mortality rate (IMR), as well as an increase in the number of the people in the reproducible age, are a probable reason for this. Though our reproductive child healthcare research program, though we could bring down their population growth rate, it was only marginal. According to the 2011 census report, the population growth rate was less than 2%, that means 20 per thousand per year, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute scarcity of even the basic requirements, that means food, shelter, and the clothing, in spite of the significant progress made in those areas. Therefore, the government was forced to take up serious measures to check this population growth rate. The most important step to overcome this problem is to motivate a smaller family by using the various contraceptive methods. You might have seen advertisement in the media as well as the poster bill etc. showing a happy couple with two children with a slogan "Hum do hamare do, be to our two." Many couples, mostly the young urban working ones, have been adopted as one child norm, a statutory raising of the marriageable age of the female to the 18 years and that of the male to 21 years, and incentives given to the couple with a small families are two of the other measures taken to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent the unwanted pregnancies. कहता है कि an ideal contraceptive should be user friendly, easy available, effective and reversible with no or least side effect. It also should in no way interfere with the sexual drive, desire and or the sexual act of the user. A wide range of the contraceptive methods are presently available which could be broadly grouped into the following categories, namely the natural tradition, barrier, IUD, oral contraceptive, injectables, implants and the surgical methods. फिर कहता है कि natural methods work on the principle of avoiding the chances of the ovum and the sperm meeting. Periodic abstinence is one such method in which the couples avoid or abstain from the coitus from the day 10 to the 17 of the menstrual cycle when ovulation could be expected. A chance of the fertilization are very high during this period. It is called the fertile period. Therefore, by abstaining from the coitus during this period, conception could be prevented. Withdrawal of the coitus interrupts is another method in which the male partner withdraws his penis from the vagina just before ejaculating so to avoid insemination. Lactational amenorrhea, absence of the menstruation method, is based on the fact that ovulation and therefore the cycle do not occur during the period of the intense lactation following the parturition. Therefore, as long as the mother breastfeeds the child fully, chances of the conception are almost nil. However, this method has been reported to be effective only up to a maximum period of the 6 months following the parturition, as no medicine or devices are used in this method. Side effects are almost nil. Chances of the failure of this method are also high. आगे कहता है कि इन द बैरियर मेथड ओवम एंड द स्पर्म्स आर प्रिवेंटेड फ्रॉम फिजिकली मीटिंग विद द हेल्प ऑफ द बैरियर. सच मेथड्स आर अवेलेबल फॉर बोथ मेल्स एंड द फीमेल्स. Condoms are barrier method made up of the thin rubber latex sheath that are used to cover the penis in the male or the vagina and the cervix in the female just before the coitus so that the ejaculated sperm could not enter into the female reproductive tract. This can prevent the conception. Nirod is a popular brand of the condom for the male. Use of the condom has increased in the recent year due to the additional benefit of the protecting the user from the contracting STI and the AIDS. Both the male and the female condoms are disposable, can be self-inserted and thereby giving privacy to the user. Diaphragm cervical caps bolts are also barrier method made up of the rubber that are inserted into the female reproductive tract to cover the cervix during the coitus. They prevent the conception by blocking the entry of the sperm through the cervix. They are reusable. Spermicidal creams, jellies, and foams are usually used along with this barrier to increase their contraceptive efficiency. Another effective and the popular method is the use of the intrauterine devices IUDs. These devices are inserted by the doctors or the expert nurses in the uterus through the vagina. These intrauterine devices are presently available at the non-medicated IOD, lipid loop, copper releasing IOD, CUT-7, multilode 375 and the hormone releasing IOD, progesterone LNG20. IOD increase the phagocytosis of the sperm within the uterus and the copper ions relieved suppress sperm motility and the fertilizing capacity of the sperm. The hormone releasing IODs in addition make the uterus unsuitable for the implantation and the cervix hostile to the sperm. IOD are the ideal contraceptive for the females who want to delay pregnancy and or space children. It is one of the most widely accepted methods of the contraception in India. Oral administration of the small dose of either progesterone or the progesterone estrogen combination is another contraceptive method used by the females. They are used in the form of the tablet and hence are popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of the menstrual cycle. After a gap of the 7 days during the which menstruations occur, it has to be repeated in the same pattern till the female desire to prevent deconception. They inhibit the ovulation and implantation as well as alter the quality of the cervical mucus to prevent or retard the entry of the sperm. Pills are very effective with lesser side effects and are well accepted by the females. Sahel, the new oral contraceptive for the female, contains a non-steroidal preparation. It is once a big pill with very few side effects and high contraceptive values. तो यहाँ पर पिक्चर में दिया हुआ है कॉन्डम फॉर द मेल्स, यहाँ पर कॉन्डम फॉर द फीमेल्स दिया हुआ है, यहाँ पर CUT दिया हुआ है, कॉपर टी, और इस पिक्चर में है जो इम्प्लांट्स दिया हुआ है नॉर प्लांट्स का दिखाया हुआ है. फिर आगे है एनसीईआरटी कहता है कि प्रोजेस्टेरोन alone or in combination with the estrogen can also be used by the females as injection or implants under the skin. Their mode of the action is similar to that of the pills and their effective periods are much longer. Administration of the progesterone or the progesterone estrogen combination of IOD within the 72 hours of the coitus have been found to be very effective as emergency contraceptive, as they could be used to avoid possible pregnancy due to the rape or the casual unprotected intercourse. Surgical method, also called sterilization, are generally advised for the male-female partner as a terminal method to prevent any more pregnancies. Surgical intervention block gamete transport and thereby prevent the conception. A sterilization procedure in the male is called a vasectomy and that in the female is called a tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum. In the tubectomy, a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through the vagina. These techniques are highly effective but their reversibility is poor. It needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in the consultation with the qualified medical professionals. One must also remember that contraceptives are not regular requirements for the maintenance of the reproductive health. In fact, they are practiced against a natural reproductive events, that means conception or pregnancy. One is forced to use these methods either to prevent the pregnancy or to delay or space the pregnancy due to the personal reasons. No doubt, the widespread use of these methods have a significant role in checking uncontrolled growth of the population. However, their possible side ill effects like the nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even the breast cancer, though not very significant, should not be totally ignored. तो इस पिक्चर में वेसेक्टॉमी को दिखाया गया है जिसमें है जो वैस डिफरेंस को टाइड एंड कट कर दिया गया है. फिर यहाँ है जो ट्यूबेक्टॉमी को दिखाया गया है जिसमें जो है फेलोपियन ट्यूब्स को टाइड और कट कर दिया गया है. एनसीईआरटी मेडिकल टर्मिनेशन ऑफ प्रेगनेंसी के बारे में लिख कहता है कि द मेडिकल टर्मिनेशन ऑफ द प्रेगनेंसी अमेंडमेंट एक्ट 2017 by enacted by the Government of the India with the intention of reducing the incidence of the illegal abortion and consequent maternal mortality and morbidity. According to this act, a pregnancy may be terminated on certain considered grounds within the first 12 weeks of pregnancy on the opinion of the once registered medical practitioner. If the pregnancy had lasted more than 12 weeks but fewer than the 24 weeks, two registered medical practitioners must be of the opinion formed in the good faith that the required ground exists. The ground for such termination of the pregnancy are the continuation of the pregnancy involve a risk to the life of the pregnant woman or of grave injury physical or the mental health, or there is a substantial risk that of the child bear born it would suffer from such physical or the mental abnormality as to be seriously handicapped. फिर आता है मेडिकल टर्मिनेशन ऑफ द प्रेगनेंसी MTP. तो इंसर्ट correct intentional or the voluntary termination of the pregnancy before the full term is called the medical termination of the pregnancy MTP or the induced abortion. Then the 45 to 50 million MTP are performed in a year all over the world, which accounts to one-fifth of the total number of the conceived pregnancy in a year. Whether to accept legalize MTP or not is being debated upon in many countries due to the emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in the 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female puticide which are reported to high in India. Why MTP? Obviously, the answer is to get rid of the unwanted pregnancy either due to the causal unprotected intercourse or the failure of the uh, unwanted pregnancy either due to causal unprotected intercourse or the failure of the contraceptive used during the coitus or the rapes. MTP are also essential in certain cases where continuation of the pregnancy could be harmful or even fatal, either to the mother or to the fetus or both. MTP are considered relatively safe during the first trimester, that means upon the 12 weeks of the pregnancy. Second trimester abortion are much more riskier. One disturbing trend observed is that a majority of the MTP are performed illegally by the unqualified quacks, which are not only unsafe but could be fatal too. Another dangerous trend is the misuse of the amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by the MTP. This is totally against Bhatij, illegal. Such practices should be avoided because these are dangerous both for the young mother and for the fetus. The effective counseling on to need to avoid the unprotected quarters and the risk factor involved in the illegal abortions, as well as providing the more health care facility could reverse the mentioned unhealthy trend. फिर कहता है सेक्सुअली ट्रांसमिटेड इन्फेक्शन FTI के बारे में, तो कहता है कि इन्फेक्शंस और द डिजीज विच आर ट्रांसमिटेड थ्रू द सेक्सुअल इंटरकोर्स आर कलेक्टिवली कॉल्ड द सेक्सुअली ट्रांसमिटेड डिजीज इन्फेक्शन FTI और द वेनल डिजीज VD और रिप्रोडक्टिव tract infection RTI, gonorrhea, syphilis, genital herpes, chlamydia, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent year, HIV, leading to the AIDS, are some of the common FTI. Among these, HBI infection is most dangerous and is discussed in the detail in the chapter 7. Some of these infections like the hepatitis B and the HIV can also be transmitted by sharing of the injection needles, surgical instrument, etc. with the infected person, transfusion of the blood, or from an infected mother to the fetus too. Except for the hepatitis B, genital herpes, and HIV infection, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swelling, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or the less significant symptoms in the early stage of the infection and the social stigma attached to the FTI deter the infected person from going for timely detection and proper treatment. This could lead to the complication later, which include the pelvic inflammatory disease PID, abortion, stillbirth, ectopic pregnancy, infertility, or even cancer of the reproductive tract. FTI a major threat to a healthy society. Therefore, prevention of early detection and cure of disease are given prime consideration under the reproductive health care programs. Though all the persons are vulnerable to this infection, their incidence are reported to be very high among the person in the age group of 15 to 24 years, the age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of this infection by following the simple principle given below. पहला कि about sex with unknown partners or the multiple partner. दूसरा कि always try to use the condoms during the quarters, और तीसरा कि in the case of the doubt one should go to a qualified doctor for the early detection and get complete treatment if diagnosed with the infection. नेक्स्ट टॉपिक एनसीईआरटी है जो इनफर्टिलिटी के बारे में बोल रहा है, बोलता है कि डिस्कशन ऑन द रिप्रोडक्टिव ट्रैक रिप्रोडक्टिव हेल्थ इज इनकम्प्लीट विदाउट ए मेंशन ऑफ द इनफर्टिलिटी. A large number of the couples all over the world, including India, are infertile. They are unable to produce the children despite of the unprotected sexual cohabitation. The reason for this could be many physical congenital disease, drugs, immunological, or even the psychological. In India, often the female is blamed for the couple being childless, but more often than that, the problem lies in the male partner. A specialized healthcare units, infertility clinics, etc., could help in the diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such correction are not possible, the couples could be assisted to have children through certain special technique commonly known as the assisted reproductive technology (ART). In vitro fertilization (IVF) fertilization outside the baby body in almost similar condition as that in the body, followed by the embryo transfer. One such method in this method popularly known as the test to baby program, ova from the wife donor female and the sperm from the husband donor male are collected and the inducer to form the zygote under the simulated condition in the laboratory. The zygote or the early embryos with up to 8 blastoma could be transferred into the fallopian tube, gift zygote intrafallopian transfer, and the embryo with more than 8 blastoma into the uterus, IOT intrauterine transfer. To complete its further development, embryos formed in the in vivo fertilization fusion of gametes within the female also could be used for such transfer to assist those females who cannot conceive. The transfer of an ovum collected from a donor into the fallopian tube gift gamete intrafallopian transfer of another female who cannot produce one but can provide suitable environment for the fertilization and further development is another method attempted. Intracytoplasmic sperm injection (ICSI) is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases either due to the inability of the male partner to inseminate the female or due to very low sperm counts in the ejaculates could be corrected by the artificial insemination AI technique. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus IY intrauterine insemination of the female. आगे इंसर्ट कर रहा है कि दो ऑप्शंस आर मैनी. All the techniques require extremely high precision handling by the specialized professionals and expensive instrumentation. Therefore, these facilities are apparently available only in the very few centers in the country. Obviously, their benefits is affordable to only a limited number of the people. Emotional, religious, and the social factors are also deterrents in the adoption of this method. Since the ultimate aim of this procedure is to have children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our law permits legal adoption and it is as yet one of the best methods for couples looking for the parenthood. अगर समरी है, समरी में कह रहा है एनसीईआरटी के रिप्रोडक्टिव हेल्थ refers to a total well-being in all aspects of the reproduction, that means physical, emotional, behavioral, and the social. Our nation by the first nation in the world to initiate various action plan at national level towards attaining a reproductive healthy society, counseling and creating the awareness among the people about the reproductive organs, adolescents, and the assisted changes, safe and hygienic sexual practices, sexually transmitted infection (STI), including AIDS, etc., is the primary step towards the reproductive health. Providing medical facility and care to the problems like the menstrual irregularities, pregnancy-related aspects, delivery, medical termination of the pregnancy, STI, birth control, infertility, postnatal, child and the maternal management is another important aspect of the reproductive and the child health care program. An overall improvement in the reproductive health has taken place in our country as indicated by the reduced maternal and infant mortality rates, early detection and the cure of the STI, assistance to the infertile couples, etc., improved health facility and better living condition, promoted an explosive growth of the population. Such a growth necessitated intense propagation of the contraceptive methods. Various contraceptive options are available now, such as the natural, traditional, barrier, IOD, pills, injectables, implants, and surgical method. Though contraceptives are not regular requirements for the reproductive health, one is forced to use them to avoid pregnancy or to delay or space pregnancy. Medical terminus of the pregnancy is allowed in our country. MTP is generally performed to get rid of unwanted pregnancy due to the rapes, causal relationship, etc. As also seen in cases where the continuation of the pregnancy could be harmful or even fatal to either the mother or the fetus or both. Infection or a disease transmitted through the sexual intercourse are called the sexually transmitted disease (STI), pelvic inflammatory disease (PID), stillbirth, infertility are some of the complications of them. Early detection facilitates better cure of this disease. Avoiding sexual intercourse with the unknown multiple partners, use of the condoms during the quarter are some of the simple precautions to avoid the contracting STIs. Inability to conceive or produce the children even after 2 years of the unprotected sexual cohabitation is called the infertility. Various methods are now available to help such couple. In vitro fertilization followed by transfer of the embryo into the female genital tract is one such method and is commonly known as the test to baby programs. तो ये रिप्रोडक्टिव हेल्थ का एनसीईआरटी हो गया.